Today we're talking about herbal medicine and irritable bowel syndrome. Hey folks, my name's Todd Mansfield. I'm a clinical herbalist here in Byron Bay, Australia, and today we're talking about two common herbs that I use when I'm working with my patients with IBS. So getting into the herbal medicine, I will frequently use peppermint when I'm working with IBS patients, and that's because peppermint has a number of really kind of helpful actions on the gut. It's antispasmodic, it's carminative, and it's antiemetic. And so if we're looking at the symptoms of IBS, things like abdominal pain and abdominal cramping, the antispasmodic action of the herb really helps here. It helps alleviate those symptoms. If we're looking at the trapped gas and the bloating from the flatulence, the carminative action can really help here. And then the last one, there's some IBS patients where they'll eat a meal and then they'll instantly feel nauseous. And so that antiemetic action can really help with those patients. So if we're looking at the science behind using peppermint, I would recommend you go check out the article. It's in the link in the description below. But as a quick summary, we have mountains of evidence showing that peppermint is effective at alleviating IBS symptoms. So the second herbal medicine for IBS would be Caraway, and I'll be truthful, I don't use this herb anywhere near as often as I use peppermint, and that's because I don't have to. I only really use that Caraway when I'm trying to increase efficacy or we're not seeing that benefit from peppermint on its own. It has similar actions to peppermint. It's antispasmodic, it's carminative, it can help with digestion, flatulence, and we do have some good evidence with the combo of peppermint and caraway, and there's even a proprietary blend called menthicarin, that's caraway and peppermint, enterically coated oils, showing good benefit in IBS patients. So as a quick little summary, I'll frequently start with peppermint leaf tincture. Now there is a possible contraindication using this herbal medicine, and that is if a patient is suffering from heartburn or reflux or GERD or GORD, call it what you will. It's stomach acid refluxing into the esophagus. Now peppermint may exacerbate that condition, so it's definitely worth treading cautiously there. So if after a month or two, we're not seeing the significant improvements that I would expect to see using peppermint, then I'll combine the caraway and we can get that kind of synergy of those two herbs that have been well studied for irritable bowel syndrome to see if we can get improvement in those patients with IBS. Thank you so much for watching. Hit the like button if you enjoyed it. I've got lots of IBS content coming up. It's a condition that I work with frequently in the Byron Herbalist clinic. If you do live in Australia and you are struggling with digestive health issues, then reach out. I treat people online using video conferencing software, and yeah, I'd love to hear from you. Thanks for watching.